Okay, so we've heard the term telehealth today, and from the comments around, it seemed that not many people had heard about telehealth. So I just wanted to give you an explanation what it means. It's the exchange of health information between patients and a health professional. A health professional can be a doctor, nurse, pharmacist, and it's basically, as illustrated by that video, the patient and the health professional are not in the same place, so they're not face-to-face talking to each other like we are now. They can be somewhere else in the world or just down the road. So telehealth systems are comprised of the following objects. I hope you can see the screen. Patients, point-of-care devices, intermediate devices, web portals, and health professionals. I don't really want to go into the complexity of what the different types of devices are, but essentially it's a system. So the diagram behind me shows a typical telehealth system, and it shows the interaction between the patient at that end with the health professional at this end. And it shows the different types of components that are involved. So you have the glucometer if it's somebody monitoring diabetes. You have mobile phones, PCs. You have carers. You have electronic patient records. You have web portals. And in essence, it can be simpler than this, or it can be more complicated than this. But just an example of the summary of it is that the patient and the health professional are not in the same place, and they're sending information between each other. So what are the benefits of telehealth systems? The first is that it helps to identify cases that are more urgent and need more priority, because if everybody's rushing off to the A&E department and they have this process called the triage process, where they have to decide who's the most important person to treat and who's the least important person to treat. So when you have a telehealth system, your results are sent automatically through a system, and then on the computer that the health professional has, it gives different signals to show whether the person is a high priority patient to attend to. In that case, they might go straight to visit them or call them up, or a low priority whereby they could say, okay, well, we can find out what's wrong with this person later on. Another benefit is that it saves on traveling costs for all the people involved. The patient doesn't necessarily have to just go to the GP or to the A&E unnecessarily if it's something that can be easily sorted out over the phone or over the computer, etc. And also the health professionals don't have to travel to the patients. And as I said, it helps to reduce the queue at the GPs and at the A&E departments, so that you don't unnecessarily just have people waiting there for minor things that they could have been easily treated over the phone or something like that. So who are the kind of people that could benefit? Well, the systems that I've looked at in my research have been people with long-term conditions, so things like diabetes, asthma, things like that. Something that there's no cure for it, so you have to regularly keep monitoring the person on a regular basis. So that's the kind of thing that a telehealth system would benefit. That's the kind of person that a telehealth system would benefit. And also people living in remote locations, maybe somebody in Scotland or in Canada, where there's, the geography is so diverse. If people suddenly need treatment, you don't want to be having to travel 200 miles just to find out that, oh, I just needed to change my medication simply by, if the information was transferred remotely, then you could have sorted that out easily. So what are the issues in telehealth? Well, there's technophobia. Some people might not like technology. We were talking about technology this morning. So some people might not simply like the idea of sending their information over the internet or over using the phone. Also, confidentiality of patients. That is an issue that it is. I'm not saying that it's not possible to have your data secure, but that's an issue that needs to be sorted out to make sure that whatever you're sending about yourself is not going to be available for anybody to just download. Government policies. The government, as we heard yesterday, are changing the way healthcare is being delivered. So this needs to be considered when, whether they are still considering telehealth or whether they might be thinking of other ways of administering healthcare. Another issue is that about health professionals feeling threatened. The use of telehealth shows that you might need fewer people because all you need is to, in that example, in the video example, was just to connect a device and then send it to an expert remotely. So if you're taking out the face-to-face contact whereby the person goes to see their doctor on a regular basis, they might feel threatened that their jobs are being taken over. And also the cost of setting up the system. It is a useful and helpful system, telehealth systems, definitely. But as I said, it would be more appropriate for somebody with a long-term condition rather than you just set up a system for just a minor thing, for one-off, and then you forget about it, because you have to think about all the costs involved. And then again, it reduces the doctor-patient relationship on a face-to-face level. It doesn't mean that they don't interact, but it's just they're not in front of each other.